Blood pressure is mainly affected by cardiac output and total peripheral resistance. Now, cardiac output is the amount of blood pumped from the heart per minute. And cardiac output as that amount of blood ejected by the ventricles, which is the stroke volume, is multiplied times the heart rate, which is the contractions per minute. An increase in heart rate will increase cardiac output, as long as the stroke volume stays the same. And this is true for stroke volume. Stroke volume increases, cardiac output increases. The total peripheral resistance is the resistance created by the blood vessels throughout the body. An increase in blood volume will increase cardiac output. Anything that causes an increase in preload, as we look at the venous return here, which is the end diastolic volume, will increase stroke volume and therefore increase cardiac output. An easy way to think about this is that if there's more blood going into the heart, then there will be more blood being forced out. If contractility increases, then there will be a greater cardiac output. And this means that if the heart has a greater force of contraction, it will eject a greater blood volume. So going back to total peripheral resistance, this is the pressure in the blood vessels that the heart must push against. So you can imagine that if the total peripheral resistance increases, then this would decrease stroke volume and therefore decrease cardiac output. Now, if the blood vessels open, we call this vasodilation. Vasodilation results in decreased peripheral resistance. Therefore, this will increase cardiac output. The opposite is true for vasoconstriction. This is the tightening of the blood vessels. If the blood vessels, and this is specifically the arterioles, if they constrict, the peripheral resistance increases. So that decreases the cardiac output because the heart has to push against more pressure. So think of this like blowing into a balloon. If there isn't very much air in there, it's easy to blow in more air because there's little resistance. Once the balloon is full, it's almost as if the balloon is pushing back at you. So the balloon has resistance, and this is like vasoconstriction. It's difficult to put more air into the balloon. Therefore, it's difficult for the heart to push more blood out. It's important to understand how the body controls blood pressure. When the blood pressure drops, multiple organs will respond to bring the blood pressure back up. Why? Well, if you don't get blood to your brain can't function. So your body works very hard at getting blood to your brain. Let's look at how the heart responds. When your blood pressure drops, the heart immediately responds by increasing the heart rate and increasing the force of contraction. The heart rate and contractility will increase, increasing cardiac output and therefore increasing blood pressure. If you increase contractility, we know that this will increase stroke volume and therefore increase cardiac output. By increasing cardiac output, your body increases blood pressure. So putting all those together, we increase heart rate, cardiac output increases, increasing blood pressure. Now, in response to the drop in blood pressure, the arterioles will vasoconstrict. The arterioles will vasoconstrict, and when they do, this increases total peripheral resistance, therefore increasing blood pressure. Now, how about the kidneys? The kidneys are also important in blood pressure regulation. And this is where the renin-angiotensin system is important. So in general, the kidneys will respond to changes in blood pressure by increasing or decreasing the amount of urine excreted. The greater the fluid output from the body as urine, the less blood volume. The less blood volume lowers blood pressure. A drop in blood pressure will stimulate renin. Now remember, renin stimulates a cascade of effects. Renin stimulates the conversion of angiotensinogen to angiotensin 1. Angiotensin 1 is converted to angiotensin 2. And that's by the angiotensin converting enzyme. Now, angiotensin 2 is what has all the effects. So the multiple effects are, 1, it increases the secretion of antidiuretic hormone, ADH, also known as vasopressin. Now remember, ADH's role is to conserve water. ADH stimulates water absorption in the collecting duct of the kidney. Now, ADH is the hormone inhibited by both caffeine and alcohol. To what extent we'll actually talk about later this semester. So this is why you may find yourself taking multiple trips to the bathroom when you drink a lot of coffee or alcohol. But if there is more ADH, then the body will reabsorb more water. Now, secondly, angiotensin 2 also stimulates vasoconstriction. And remember, this will increase peripheral vascular resistance. And by increasing peripheral vascular resistance, blood pressure will go up. So angiotensin 2 will also stimulate aldosterone secretion. Now, aldosterone increases tubular sodium and chloride reabsorption. Now, wherever sodium goes, water follows. So if sodium's reabsorbed, so is water. What does this do? This increases blood volume and therefore blood pressure. Lastly, angiotensin 2 stimulates sympathetic activity. Sympathetic activity causes vasoconstriction. Vasoconstriction increases total peripheral resistance, and this results in an increase in blood pressure.